So we are studying food and nutrition. In food and nutrition, we completed yesterday vitamin C and vitamin K. So vitamin C is water soluble. So we are starting now water soluble vitamins. Water soluble vitamins. So let's start. So I already told you that B complex and vitamin C are the water soluble vitamins. Okay. In the water soluble B complex having different vitamins like B1, B2, B3, B5, B6, B7, B9 and B12. So total 8 vitamins. So total 8 vitamins become complex and we will call as B complex. Okay. So they are very essential for our body. So in that we will discuss first B1. So what we will talk about function, okay, deficiency, source, recommended daily allowance. We'll discuss four things regarding every vitamins. So vitamin B1. So basically vitamin B1 is also known as thiamine. The scientific name of vitamin B1 is thiamine. So we'll call B1 or thiamine. Both are same. What is the in the 1858, during 1858 to 1930, it is the development of B complex of water soluble vitamins mostly. Okay, so one scientist, Christian Ajax, a Dutch physician in Java, he observed neurological abnormalities in the chicken. Okay, so which were fed on a highly polished rice diet, which disappears on feeding bran. So mostly these chicken are in highly polished rice diet, but he observed neurological disorder. What he did, he advised bran. So after giving that, all are become normal. Okay, so after later on, he observed that due to the deficiency of vitamin B, the chickens also developing neurological disorders. Okay, so it is very important. So basically, what is the function of thiamine? So let's now discuss thiamine functions. Functions of thiamine. Thiamine functions is first energy transformation. First is energy transformation. First function is, so I already studied that this vitamins not giving energy, but they supports to provide energy. So likewise, after ATP energy is converting ADP, so whatever mechanism will happen in the cell, so B1 is needed to transfer the energy. Okay, to transfer the energy because uh, it is very essential to transfer the energy. Next is second function, synthesis of pentose and NADPH. Synthesis of pentose and NADPH. NADPH. What is that? That is the coenzyme. TPP is also a coenzyme of the enzyme transcriptase, which is required for the metabolism of glucose. So why we need this pentose and NADH to the synthesis of glucose, metabolism of glucose, sorry. Okay, in the liver and the adrenal gland, as much as 60% of glucose can be used. Okay, it is the only way in which the body can produce the ribose and deoxyribose sugars needed for the synthesis of ribonucleic acid. So basically, it will help to utilize the mostly glucose synthesis, glucose metabolism. So it's another thing that it is all then we need glucose for metabolism. We need for energy. So here also the metabolism of glucose happens in the presence of vitamin B1. So there's the reason we need B1. So here energy transformation, same thing is happening here. And the third important function is the neurological conduction or nerve conduction. So we knew that the pulse which travels on the nerves need conduction and forwardation. Nerve conduction. What it will do, thiamine is involved as in the transmission of high frequency impulses, okay, across nerve synapses. THAN appears to involve either in the production and release of neurotransmitter. Okay, what is the name of neurotransmitter? Acetylcholine. Okay, so basically it will help to travel the impulses in a particular manner. Okay, so without if the deficiency of vitamin B will happen, so the transmission of pulses will go in the very late phase. What will happen? The neurological disorders will happen. The patient doesn't have nerve impulse issues. Due to the deficiency of vitamin B1, the nerve impulses cannot reach properly. So, and that doesn't receive the information properly. So there's the reason what we need. We need vitamin B1, thiamine, very, very important. And fourth important function of vitamin B is that is conversion of amino acids. What we do? Conversion of amino acids. Conversion of amino acids. What is meant by conversion of amino acids? One second, please. Conversion of amino acid means thiamine is involved in the conversion of amino acid tryptophan to the vitamin niacin and the metabolism of branch chain amino acids. So the muscles need the muscles need amino acids. So what in the under the absorption of thiamine, the amino acid will convert in that form. The muscles will utilize that. Okay, so this is the important thing related vitamin B1. So, and we need basically the amino acid, the vitamin B1, it cannot be stored. Okay, we need 30 mg per day. So, whatever excess amount it will excrete from the urine. Okay, it is excrete from the urine. So, dietary source. Dietary source, what are the sources? The sources of B1 is whole grain, and we have cereals, yeast, rice, means without polish, and pulses, wheat, wheat germ, wheat gum, nuts, milk. Okay. Daily requirement, how much amount we require? Sources is that requirement is 0.5 mg per 1000 kilocalories. Minimum 1.5 milligram per day. We need 1.5 milligram per day. So body can store 30 mg. The excess amount will release from the body. Okay. So what will happen? If deficiency of vitamin B1 will happen, what will happen? Deficiency. During what we will do, we'll wash the food or prolong storage of food, especially rice. Okay. So the amount of vitamin B1 may be reduced from the food. So patient will develop neurological symptoms like fatigue, initial symptoms, and irritability and poor appetite, decreased appetite, less appetite, tingling, okay, numbness, because it is necessary for neurotransformation or impulse transformation. We need that. Okay, inadequate uh, glucose to the cells, because in the presence of B1 only energy transformation is happening. Mainly one disease occurs, that is beriberi. We'll call the disease is beriberi. What is beriberi? Beriberi are two types. One is dry beriberi and wet beriberi. Dry means it will affect nervous system, central nervous system, mostly peripheral nervous system, not peripheral. And wet will it will attack on cardiovascular system, nervous system and cardiovascular system. In the dry beriberi, neurological symptoms will occur like difficulty in walking, muscle paralysis, pain. So these are the symptoms. And in the dry wet beriberi, increased heart rate, shortness of breath, leg swelling. Okay, all these are symptoms. We will call another beriberi, that is infantile beriberi. Infantile breathing difficulty in the baby, crying, cardiac issues, can be acute and sometimes fatal. So these are the diseases due to the deficiency of vitamin B12. You can check that. And another disease that is more common, that is Wernicke encephalopathy. We will call Wernicke encephalopathy. Wernicke encephalopathy means it is characterized by ophthalmologia, polyneuritis, ataxia, mental deteriorations. So mostly this occurs in the alcohol person who take alcohol, consume alcohol, okay, due to the ophthalmologic ophthalmologia means pain in the eyes, nerves inflammation, and difficulty in walking, mental issues. All these are seen in the Wernicke encephalopathy. How we can prevent? We have to take diet rich with thiamine, okay, especially unpolished rice. Nowadays we are taking polished rice, so most of the persons are having neurological diseases due to the decrease of thiamine. So we have to improve our food quality, maybe sometimes required supplements. Okay, so this is important thing about vitamin B1. So all the things are understood. So we discussed about function, sources, diet, RDA also 1.5 mg per day, minimum 30 mg is stored in the body. Extra amount will release from the body. Now we will talk about second vitamin B2. B2 is also called riboflavin. Most of the person knows this. Okay, riboflavin. Riboflavin is discovered in 1933. Most of the nutritions are discovered at that time only. It is very, very important in cellular oxidization. What is the function? Cellular oxidization means to to nutrient the cell, to remove the waste product from the cell, to maintain healthy environment in the cell. We'll call is uh, oxidization. Is a cofactor, and also cofactor helping other things between the cells, whatever important things for energy metabolism. Okay, so how much amount we require? Infants need 0.5 mg daily. Children's needs 1 mg. Adults needs 1.5 to 2 mg. In the pregnancy, additional 0.2. Lactation 0.4. Generally, if you are doing more functions, need 0.6 extra. Sources now. Source milk, liver, eggs, leafy vegetables, okay, cereals, pulses, okay. So here, most of the vitamin B2 is present in mostly non-vegetables. Vegetables, you have least amount. You need to take high consumption to require to reach the required amount. Okay. What is the functions? So we talk functions. Functions is vital for metabolism of other vitamins like vitamin B1, niacin. Okay, act as coenzyme. Okay, between protein and carbohydrate. Key cofactor in numerous enzymes. Okay, carbohydrates, fats, proteins, and oxidization. Okay, what will happen if vitamin B2 deficiency occurs, riboflavin deficiency occurs? What will happen? Often deficiency of B complex vitamins, particularly prevental in population. Okay. First is chalosis. Chalosis. This is the one disease. Yeah, I think you know that is in front of the lips. We have some swelling. So that is nothing but chalosis. And angular stomatitis means cracks of lips, glossitis, tongue inflammation, itching, burning, watery eyes, dermatitis in some conditions. So mucosal infection are seen due to the deficiency of vitamin B. So what will happen? We have to take the improve the need of vitamin B2. Okay, vitamin B2. So we need to improve. How much amount you, if the deficiency occurs, if you saw the deficiency, you have to take 10 mg per day for 1 month regularly, 5 mg for children. Okay. So this is about vitamin B2. Not now we will talk about vitamin B3, that is niacin B3. It is also discovered in 1937, okay, to cure pellagra, a disease. Okay, we required in men adult as infants 5 to 8 mg, children 10 to 15 mg, adult 18 to 20 mg. Okay, women 14 to 16 mg, pregnancy add 2, if your lactation add 4. So these are the daily requirement of niacin. Okay, what is the source? Yeast, or liver, rice without polish, unpolished rice, peanut, meat, fish, legumes, cereals, mostly whole cereal, having very important amount of niacin. Why we need niacin again for metabolism. So all these are B complex need for metabolism. So they are the helping, conducting, and serving between glucose, carbohydrates, proteins, and fat. Okay, and essential for skin, intestine, and nervous system. Likewise, B1, B3 is also very important for skin, intestine, and for neurological symptoms. Neurological symptoms. One of the important disease occurs due to the deficiency of vitamin D3, that is pellagra. What is that? Pellagra. Pellagra, what is pellagra? It is a disease in that diarrhea, dermatitis, okay, will occur, and swallowing tongue, okay. So these are the simple and important uh, deficiencies you can see through that vitamin B3 deficiency. Okay, next vitamin is vitamin B6. We discussed B1, B2, B3. Now is B6. B6 is also known as pyridoxine. What is the next name? Pyridoxine. Pyridoxine is discovered in 1938. Okay. We need 2 mg per day daily requirement. It is present in dried yeast, okay, wheat gram, rice, unpolished. So in the unpolished rice, you have B complex. So we are using polished rice. That's the reason we are not getting sufficient amount of B complex. Fresh milk, not uh, refrigerated milk. Whole grains. Whole grains are very important. Nuts, soya beans, groundnuts. Nuts. Okay. What is the function? Again, to synthesize amino acids and break down. Okay. It is very important. So, what will happen? Vitamin B6 will deficiency occurs, anemia occurs, that is hypochromic anemia, neuritis, okay. Some have skin lesion, skin problems, convulsions in children sometimes, vitamin B6 deficiency. So, you need 2 mg per day according to the uh, age. Infants need 0.5 mg, children's needs 1.5 mg, adults need 2 mg, pregnant and lactating women 2.5 mg. So these are the four B complexes we discussed: B1, B2, B3, and B6. So remaining we will discuss in coming class. So then we will complete our vitamin chapter. Okay. And next we have vitamin B12 and vitamin B12. After that we have folic acid, pantothenic acid. Okay. These are the remaining 2 to 3 uh, vitamins we will discuss in